We're here with Dr. Chris and Dr. Davina Denischek, who this week are testing people to see if they could be at risk from Britain's biggest killer, cardiovascular disease, which is responsible for about a third of deaths in the UK every year. That is phenomenal, isn't it?
Yeah, it is. Now, cardiovascular disease is disease of the arteries to the heart, but also diseases of the arteries to the brain and to the lower limbs. But this morning we're concentrating purely on the heart, heart attacks.
So, who's most at risk?
Well, you're more at risk of a heart attack as you get older. You're more at risk if it's in your family. Now, you can't do anything about those two factors, but they're sort of flashing lights to warn you. Now, the other risk factors, the biggest single risk factor is raised cholesterol. Then you have blood pressure and blood sugar. Now, you don't know those. You don't feel a raised cholesterol. You rarely feel a raised blood pressure or raised sugar.
So are there any signs or symptoms that you can keep an eye out for?
Well, yes. I mean, if the disease is narrowing of the arteries because of the fats coating the arteries and a blockage occurring. Could be partial, could be complete. Partial blockage of the coronary arteries causes angina. Now, angina is chest pain. It can feel tight or quite heavy when you exert yourself.
Right.
Worse after food or going outside in cold air after food. Now, that is relieved by rest. Now, if angina persists for more than 10 to 15 minutes, 999, could be a heart attack. Now, a heart attack, the pain is far more severe usually, right? Some people have a silent heart attack, but in most cases, very tight chest pain or heavy weight radiating into the neck or the jaw or down the left arm. You may be short of breath, you may be sweating, clammy, and patients often describe a sense of impending doom. Now, patients...
I'm not surprised.
Oh, yeah, yes, yeah. But it's funny how they all sort of say that, you know. And the thing to do then is actually aspirin straight away, very important. You know, I've mentioned this before. In my left pocket, I carry a thing called an Aspod with 2 aspirins in there. Take them straight away, because when the paramedics arrive, the first thing they'll do is give you aspirin.
And that's because that thins the blood?
Thins the blood.
Yeah.